Hello and welcome to the Global Dialogues. I'm Shereen. Bhan. The Haryana government, in collaboration with Deloitte, has launched the Sanjeevani Pariyojana. It's a project which claims to be the most ambitious initiative to shift the burden of care from hospitals to homes, and it aims to treat patients with mild to moderate COVID symptoms. This is being done by a team of doctors and nurses through a centralized command. To talk us through this effort, as well as the effort on to try and bring oxygen concentrators and other aid material to India via the USISPF partnership, joining us now is the CEO of Deloitte, Punit Renjen. Punit, many thanks for joining us here on the Global Dialogues. Always a pleasure. Thanks for your time. I want to start by talking to you about the Sanjeevani Pariyojana, Punit, and I know that this is something that you're working on personally. It's a project that's very close to your heart, and it's born out of your own personal experience of having to manage your mother who was COVID positive and doing it across time zones. Take me through that experience.
It's good to be with you. I hope you're all well. Yes, my mother did contract or get COVID, and it was a difficult process. She had been vaccinated. She had got the first shot and got COVID in between the first and the second shot. And it was a difficult process managing her care at home, but it also sparked, if you will, some of the thoughts that led into the creation of Sanjeevani. But thankfully, she is now recovered, and my hope is that she will stay healthy.
Well, that certainly is our hope as well. But Punit, I want to go over the details of what you hope to do as far as the Sanjeevani Pariyojana is concerned. You're starting with Karnal, which is in a sense the home district for you. You're doing this in partnership with the Government of Haryana. You're hoping to roll this out statewide. Take me through the learnings on being able to put this together and whether you are hoping to replicate this across India.
This is a very interesting, I think, an innovative, relatively simple, fit-for-purpose scheme, very Indian in many respects. The Government of Haryana, the Health Department in Haryana, has been doing some really wonderful, innovative work. And what started this was, of course, my personal experience with my mother. But if you look at Karnal, 90% of the patients can be treated with home care. And if you go back to the start of the second wave, there was a rush onto the hospitals and onto the healthcare infrastructure because of misinformation, frankly. And so that was the impetus, if you will, to cooperate with the Government of Haryana, with the Public Health Foundation of India, and the PGIMS to design this program, to see as to how we leverage what the government is already doing with assistance from Deloitte, and see if we can try and address the need of individuals, particularly around home care and particularly in hard-to-reach rural communities. So let me just walk you through this, if you will. First off, Rohtak is my home district. I grew up in Rohtak, not Karnal, but we picked Karnal because it was a semi-rural district or has a big rural community. And the way that the program has been designed, it has 4 integrated, interrelated elements. The first is a command and control center. We used available software, technology that already existed in Haryana to stand up a command and control center so that we could understand as to what the status was in the district at any given time. And we could also monitor, if you will, the patients that were positive. There were about 5,500 patients when we started this in the beginning of May, about a 20% plus positivity rate. But the key number here is above 90% that we believed could be treated at home. The second element is, I think, the critical element, which is around virtual healthcare. And what we did was we deputized, working with the PGIMS and the state government, 200 medical students, and created a virtual capability so that they could monitor patients remotely. And we also created 6,500 health kits. These included an oximeter, a thermometer, basic medicine. And then this is the uniquely Indian aspect, and leveraging what the state has already done. We levered the ASHA workers and the Anganwadi workers to get this out to rural communities and also to train them, to interact with them. The third element, which I think is important as well, is a three-tiered healthcare system, again, working with the state at the local Zilla level, at the district level, and then, of course, at the final hospital to stop the crush of individuals running to the main hospital in Karnal. We hired 8 advanced life-saving ambulances so that they could be transported, but it also sent a clear message to the people that were being treated at home that if you needed it, there were ambulances parked to be able to take you to the main hospital. A great public-private partnership, I believe.
Yes, it is an example of a public-private partnership that's working on the ground. But, Punit, I want to take this across to the larger area of Deloitte's operations in India. About 15% of your workforce is operating out of India. Work from home is the new normal, and that's been the course of how things have operated through the course of the first wave and now the second wave. But, as we now move out of this and prepare ourselves for future eventualities, what do you believe the new normal is likely to be?
I think that's an excellent question. I'm asked that a lot, Shereen. But first, let me say you're absolutely right. 50,000 of my colleagues, so this is deeply personal to me, 50,000 of my colleagues call India home. And our first responsibility is to protect and support them, and we're doing multiple things to do that. But this pandemic has been, of course, terrible on many levels, and it's been really disruptive in the way that we work, in the way that we live. There have also been some affirming elements to it. Let me take the Deloitte example. We have 300,000 professionals globally, and we overnight, about 14, 15 months ago, had to take them remote like everybody else did and work remotely. We have 900 offices globally. Now, will we need 900 offices after the pandemic? Probably not. Will we all work remotely after the pandemic? No. What will change is that for us in the lease, it will be a hybrid model, and the way that we structure our offices, the way that we structure Deloitte universities are going to change, more focused on collaboration, more focused on an open environment. So that's a disruption that has led to a pretty significant change. Supply chains have been disrupted. Every CEO that I speak with that is in manufacturing understands that. That will have to be reimagined. There have been some affirming aspects of this pandemic as well. The first is the fact that we've digitized or leveraged technology in the way that we work and the way that we live. And I think that has accelerated as a result of the pandemic and will continue. The other interesting thing, Shereen, is that this has given us all, every one of us, at an individual level, at a company level, at a societal level, an opportunity to reassess. I used to travel 3 weeks a month. I'm never going to travel 3 weeks a month going forward. It's given us a chance to look at climate, given us a chance to look at things like systemic racism and approach them differently, hopefully coming out of this pandemic and build back better.
There's several interesting things that you said there, Punit. You said that you may not necessarily need 900 offices in the future as you move to a more hybrid style of working. You may not travel the 3 weeks that you were previously doing. What will that mean then in terms of a structural shift for some of these sectors? Are we likely to see hospitality, travel, tourism, real estate? What do you believe the medium to long-term impact is going to be on some of these industries and sectors?
All of them, companies as well as these sectors, will need to evolve. I'm not trying to suggest that we're not going to have offices. We certainly are. The configuration of those offices are going to change. We're going to reassess the way that we used to work. I mean, on many things, Zoom and some of this technology that you and I are speaking over works really well, and we will continue to do that. But I think there is a need and a requirement for us to have human-to-human interactions. We are social beings, and so the nature of the interaction will change. And companies like Deloitte and others will need to evolve. We certainly are.
Punit, one of the other issues that I know that you've personally been focused on is the diversity agenda, and that is a key priority for you at Deloitte. Now, one of the implications of what we've seen happen with the pandemic is the impact on women, and across the globe, the impact of the pandemic on working women has been disproportionately higher. We've got study after study talking about that. The World Economic Forum has said that countries will need to approach a recovery plan through a gender lens as well and build that into the recovery and resilience plans. How do you look at that at Deloitte, and what do you believe we're likely to see happen on account of the pandemic and the move towards greater diversity? Is there going to be a pushback, a setback?
Well, as I said, this pandemic has been impactful in a negative way across many dimensions. One study that we did, which we released about a week ago, was exactly to the point that you're making, which is the impact on women, particularly working women, has been inordinate. And it has impacted not only their ability to work, but also mental health issues. And I think this is something that organizations like Deloitte need to proactively address. Diversity, particularly gender diversity, is an incredibly important topic. Let's take Deloitte as an example. Our intake of women and men at the start of their careers is about 50-50. But when you reach the partnership level, which is the highest level within Deloitte, it is not 50-50. In fact, when we started the journey about 2 years ago, it was 19%. That doesn't make sense on multiple dimensions. It doesn't make sense from a standpoint of doing the right thing. It doesn't make sense in terms of doing the right business thing. And so we've been really focused on changing that. It is not easy to do, but we are committed. We're going to be relentless, and we have moved the needle positively on that dimension. But now we need to factor in the impact that the pandemic has had on working women, and I think we will need to come up with interventions to make sure that we address those and to take those on board as we continue the journey towards gender parity.
Do you have any specific interventions in mind that you believe will need to be taken forward to address this challenge?
The one, example is mental health, and I've formed a consortium, if you will, with other CEOs to address mental health. And that applies not only to women, though it has been, as I said, an inordinate impact on women, but it also applies to men. To be honest with you, this 14 months that we've gone through has been difficult on me as well, as an individual leading a large organization. And it is important for us to acknowledge that there are mental health, like any other issue that we face as human beings, is something that we all need to tackle, and then have appropriate resources available so that professionals can access, can address mental health issues. So that is one specific intervention that we are undertaking within Deloitte and in collaboration with other leading firms across the globe.
Well, that's good to hear. You were talking about the disproportionate impact on women, which is, of course, one of the negative implications of the COVID pandemic. But perhaps one of the positives could be an acceleration of the move towards ESG metrics and ESG funding. Now, the world at this point in time is seeing a super abundance of capital. Deloitte, along with the other consulting firms, was responsible for putting together some of the metrics that the World Economic Forum, etc., have created in terms of ESG reporting, and that perhaps will aid building around this movement. Do you see a significant change in investment flows on account of this going forward?
Absolutely. And as I said in response to a question earlier, Shereen, it would be a real shame if we did not build back better, if we did not learn from this pandemic. And there are multiple efforts underway to address climate and other ESG-related metrics. The effort that you referenced, the Big Four, along with Bank of America and the World Economic Forum, came up with metrics around 4 dimensions that we believe are eternal around people, planet, prosperity, and the principles of governance. 21 metrics. There are about 70 organizations globally that have voluntarily agreed to report on those. We believe that if you report on something, it gets embedded. But it is really, really important for all of us to address issues like climate. And if we don't, I think the next generation will look back on us and rue the day that we didn't take up the challenge of addressing climate. It is the issue of our generation. The other issues that are really important, you touched on them. Diversity is very important. Health equity, when we talked about Sanjeevani, one of the wonders of what we're trying to do with the state government of Haryana is to try and get access to healthcare, primary healthcare, to the rural communities. I mean, India is investing, rightly so, in wonderful medical facilities like the All India Institute of Medical Sciences, etc. But these are in Tier 1, Tier 2 cities. And to be able to get primary health into rural communities where the bulk of India lives is absolutely critical and part of that ESG push in addition to climate.
Well, Punit, I also want to talk to you about the India-US relationship because you're a part of the USISPF and you've been sort of, facilitating a deeper engagement along with other members on both sides. Given where we currently see things, the US, of course, has sent in a lot of relief at this point in time. In your words, this is India's hour of need. But building on the momentum of the past and taking it forward, what do you believe the cornerstones of the trade and investment strategy needs to be?
Shereen, I believe that the US and India are natural allies. And going forward, I believe the relationship needs to be a very special one, a very tight one, and it is in the interest of both countries, the oldest democracy and the largest democracy. Individuals like myself that call both India and the United States home. So this is really a natural alignment, and the two countries really need to work well together, which I am actually convinced that they will. And an example of that is what the U.S., both at the corporate level as well as the government level, is trying to do. I'm proud of that, to help India. By the way, India helped the United States when we were going through our waves. This is a global crisis back in the fall and winter of 2020. And so I really believe that this is the right thing to do for both countries. And maybe the silver lining out of this pandemic is a reaffirmation that the two need to work together, whether it is in health, in security, in business, on vaccines. It is really important that the two countries work together as their natural allies.
Yes, since you brought up the issue of vaccines and health, Punit, and both sides are engaging with each other at this point in time. But given, your observations and your insights on what's happening with companies like Pfizer, etc., how they're operating and engaging with governments like the US government and other governments around the world, do you believe that issues like the indemnity clause, etc., are issues that will need to be addressed by India before we can actually see supply coming in from either Pfizer or Moderna?
Shereen, I'm not qualified to address that. I don't understand or I don't have access to all the details, but I do know that Pfizer, Moderna, other vaccine producers have arrangements with governments across the globe, and I'm certain that the Indian government, in negotiations with Pfizer and Moderna and others and the United States government, is using that as a starting point. But I will leave that up to the government as well as the individual companies.
Fair point. Let me ask you about what you make of the global economy at this point in time, given the rollout of the vaccination and the pace of rollout of the vaccination in economies like the US and UK. The hope is that there will be a faster recovery. What's your own take on global growth and how fast we can actually perhaps start to see a strong, sustainable recovery from here on, and what that could mean in terms of corporate deals, in terms of investment flows?
Well, we've seen this in the United States, which is a little bit ahead, if you will, in terms of the virus and the impact of the virus. We just celebrated Memorial Day. It was one of the busiest travel days. I think increasingly there is a sense of normalcy coming back into the United States and into the way that we live and work in the United States. We're still cautious and we're taking precautions. But the moral of the story there is that you have to first address COVID. Through things like social distancing, masking, as well as vaccination. And I think the vaccine program over the last number of months in the United States has been a real success. Over half the country now is vaccinated, and as the president said, we are targeting 70% by July the 4th. So tackling COVID is the recipe for getting back to growth. And once we do tackle COVID, I am optimistic that we will get back to significant growth. In the United States, that number is 5 to 6%. I believe that we will get to that in the least right after COVID is behind us, or the surge of COVID is behind us. In India, the predictions at the beginning of the year were double-digit growth. I'm still very optimistic. The second wave certainly may have dampened the growth curve, if you will, at the start of the growth curve. But I'm optimistic that India will get back to double-digit growth. But we have to tackle the virus first and foremost. Shereen, on the longer term, as I've said multiple times, I believe this could be India's century. India has all the ingredients, from talent to demographics to the consumer base, for this to be India's century, and for India to take its rightful place as one of the leading economies and countries in the world. But we must.
Well, that is the perfect note then to bid adieu to you. Yes, that is a perfect note then to bid adieu to you, Punit Renjen. As you point out, this could be India's century. Appreciate you joining us here on the Global Dialogue. Thanks very much for your time.
Thank you.
We'll take a break. There's a lot more coming up. Don't go anywhere. We're back in a moment.